You know, when we started seeing robots on the assembly lines of car makers, we thought that was the coolest thing in the world. Well, the world of robotics has come so far ahead that they're now using it in surgeries. Well, today we're at Biloxi Regional Hospital talking to one of the surgeons with South Mississippi Surgeons, Dr. Nicholas Fayard. How are you doing, sir?
Pretty good.
I'm just so overwhelmed, just beside myself with the fact that y'all are now got to the point where you're using machines to do such fine, detailed surgeries, and here you're using the DaVinci. So tell us about your background as a surgeon and what kind of things you specialize in.
Well, general surgery, it's mainly anything in the belly, gallbladders, appendix, colon surgery, and then we go outside of it and do a lot of breast work, and if someone has a skin lesion, we can excise that, skin cancers, a little bit of everything, but mainly concentrating into the abdomen.
Now, the use of the DaVinci robotic unit, has it made it a lot easier than just going in with hands and doing it yourself?
Yes, there's more of a direct extension of your hands, so to speak, as opposed to me having an instrument in my hand.
Right.
I have control over more precise movements using the robot arms, which are attached to the instruments which help dissect the gallbladder.
Now, as far as gallbladder surgery, you mentioned one of the major things that you work as a surgeon work with, as far as doing the gallbladder surgery.
Yes, yes, we do.
Now, when you do these surgeries, as compared to laparoscopic. Now, a few years ago, I had to have a hernia removed. They did it laparoscopically, which I thought was great because where they did the incisions. This is actually a lot finer than doing something like that.
It is.
Tell us about that.
The wrist on these instruments is more than what your normal wrist can do. So if you have your hand on an instrument, you only have so many degrees that your wrist can physically move. With the robot, I'm controlling it with my hands, but the actual wrist, which are attached to the instrument of the robot, have a more flexible feel to them, and they can get around tougher corners rather than me grasping an instrument myself.
So, I mean, we have someone here on the table. So basically, you go in, I mean, still by the belly button area.
Actually, it's different from the routine laparoscopic way we've been doing things. Laparoscopic surgery has been around for gallbladder removal for about 25 years.
Right.
And the premise behind that was 4 incisions, one around the belly button, and then usually one up in the top middle part, and then 2 other ones down the right side below the rib cage.
And that was a laparoscopic way, right?
That is a laparoscopic way.
Okay.
Now with the DaVinci, we have it to where we can make 1 incision through the belly button, measuring 1 inch long. So you think of that inside of a belly button, we can hide that incision pretty well.
Yeah.
And the cosmetic value is very much a staple of this robot surgery.
Yeah, 'cause it doesn't mess up the. I mean, if a woman has it done, it doesn't mess up her bikini line or anything.
No,
like that.
it does not.
But I think it's absolutely amazing, and to look at this machine, this is the part of it here, and you have some of the pieces here that actually go in those. Can you show those to us?
Yes, these actually hook on to the robot arms, and depending on what you prefer, what surgeons prefer in the right hand or left hand, it will vary, such as curved scissors that's used to cut the structures that we need to get off, to cut before removing the actual gallbladder.
Right.
The cystic duct and the artery. Those are the 2 things we have to take care of before getting the actual gallbladder out of the patient. So this helps cut those structures. And if we have to put any sutures in there, normally we don't for gallbladder surgery. This is what they call a needle driver, used to
throw the needle through there?
Throw the stitches. And this is another variation of the needle driver, again, to throw the sutures if need be.
Now, whenever you're doing it with this, instead of, I mean, like you said, when you did it the laparoscopic way, you had all the different areas. I would imagine that's going to have a tendency to have more recovery time for the patient. It's going to be sorer. Now, does this cut back on that?
Correct. It does. Usually with the laparoscopic approach, you have 4 different areas where they can be hurting from. And a lot of times they will hurt at the area of the biggest incision. And that varies on the surgeon's way of doing it. It's usually either the belly button or the top middle portion.
Okay.
But when these patients come in, they're hurting in the general vicinity. I've noticed that with the single site surgery, they hurt in that one spot where the incision is, but it's less intensive pain. And with that, helps them get back to work and school quicker, helps them get
So the downtime is very minimal.
Much shorter, and getting out the hospital is shorter as well. Usually these folks come in for an outpatient surgery.
Really?
They go home.
Gallbladder surgery can be outpatient surgery
They
nowadays?
go home the same day.
That's
Yes, sir.
amazing. And I mean, technology again has come so far in the fact that, you know, using robots, it seems to me like it might come a point one day where you can program it and it'll do it on its own.
I'll be out of a job if that happens.
Hey, you've still got to do all the fine work, the fine touch work, whenever
Correct.
it comes to that. So I don't think you're going to have to worry about that anytime soon. So now, as you mentioned, that's with the gallbladder and the other types of surgeries that you use this for nowadays?
Other applications include colon surgery. Now, the robot was first used widespread in pelvic surgery. Urologists use it for prostates, and gynecologists use it for hysterectomies.
Right.
And it served a special purpose in those confined areas in the pelvis that it's really tough to get down to, whether you make a big incision or you use the multi-incision laparoscopic approach. And over time, it has grown into colon surgery. That's also in the pelvis, removing someone's colon for colon cancer.
Right.
Hernia repair has also gained popularity in using the single site robot method. Gallbladders have increased the most in recent years, becoming more commonplace to have a gallbladder be removed single site robot.
And there's a lot less chance for complications afterwards.
Yes.
Doctor, we appreciate your time. This is absolutely amazing. And again, where this technology has come forward with us here. So if you'd like some more information about that, maybe you're needing some surgery, you have to check with your doctor first. And of course, they can refer you to South Mississippi Surgeons. And maybe you'll end up getting it removed very easily by a robot here at Biloxi Regional. So again, thank you, Dr. Fayard.
Thank you, sir.
Thank you for being with us.